Assalamualaikum. My name is Fatini Asyiqin, metric number 280480. Today I want to present about the data of heart disease. Heart disease is a type of disease that affect the heart or blood vessel. Smoking, high blood pressure, high cholesterol and unhealthy diet, lack of exercise and obesity can all increase the risk of heart disease. In this data, we are analyzing data to learn more about the heart disease in the general population. The objective of the study are to analyzing responder profile and the sign of heart disease sufferers. Lastly, to analyzing the critical state of heart disease. Next, I will discuss about methodology. The type of statistic is descriptive statistic. It is divided into two categories, which is measurement of central tendency and measures of variability. Furthermore, we obtain secondary data for our study using data got from the data collector. Based on this data given, the scale of measurement for qualitative data is nominal and ordinal, while for quantitative data, we are using interval and ratio scale. We are using Microsoft Excel for data analysis. It is convenience of use and cost by using Microsoft Excel. Next, this is about responder profile analysis by age. Highest frequency is known as mode, which is 9 heart disease sufferers. We have 3 modes. Meanwhile, the lowest frequency is adopted by 29, 34, 37, 42, 68, 69 and 70 years old, which is only 1 heart disease sufferers. The mean is 52.70 years old. In the other words show, most likely the heart disease sufferer is between 52 to 53 years old. Next, this is about responder profile analysis by gender. We can see from the pie chart above that male have the highest frequency of 72%, while female have just 28%, totaling to 150 people. A total of 42 women who were found to have heart disease, which is less than males. The mode of gender is male. That's all for me. Thank you.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nadiah Izzafirah Binti Zainon. My metric number is 280706. Firstly, I would like to tell about the analysis related to the topic. Okay, for the first one, we measuring the patient with heart disease by age. From the bar chart, we can see clearly that the mean for the patient with heart disease by age is 54.14. Other than that, mostly patients with heart disease are more potentially have a heart disease at the age of 51 years old. The standard deviation for patient with heart disease by age is 8.6. Okay, secondly is we analyzing patient with heart disease by gender. From the bar chart, we also can see clearly that the male patient has higher frequency rather than female. The frequency of male is 108 patients, while female is 42 patients. Moreover, the percentage of male patient is 72%, while female is 28%. From this, we can see that the most of patients suffering the heart disease. For the third one is measuring patient with heart disease by chest pain type. From the bar chart, we can see that asymptomatic is the highest frequency of the chest pain type among all the type. The frequency of asymptomatic is 66 patients and followed by the non-anginal pain, atypical angina and typical angina. Asymptomatic also get the highest percentage compared from the other chest pain type, which is 44%, and the lowest one is a typical angina.
Assalamualaikum, my name is Irmah binti Rahim and I would like to present my part, which is 3.2.6, to analyze the maximum heart rate achieved based on the respondent sex. Okay, we can see the bar graph 3.2.6 that the mean score of female respondents is higher than the mean score of male respondents. The mean for female respondents is 152.476, while the mean for male respondents is 151.962. The differences of mean score between female and male respondents is only 0.5. So it shows that female respondents are likely have high heart rate than male respondents, which female respondents can easily get heart disease than male respondents. Next is to measure the respondent's serum cholesterol in milligram per deciliter based on respondent's age. You can see through the bar graph, it is obviously showing the increasing of mean for respondent's serum cholesterol in body that influenced by their age. We can see that the lowest mean is 204 for respondents between the age of 21 to 30 years old. Meanwhile, the highest mean is 283.5 for respondents between the age of 70 to 80 years old. From the age of 41 to 70 years old, the mean is showing the increasing. So we can say that the older the respondents is, the higher serum cholesterol that contained in their body. Next is to analyze the resting electrocardiographic ECG results based on the respondent sex. We can see the bar graph that female respondents have higher mean score than male respondents. The mean for female respondents is 1.19, while mean score for male respondents is 1.09. We have three value. Value 0 means normal resting ECG. Value 1 means respondents having ST T-wave abnormality, which is T-wave inversions and or ST elevation or depression of more than 0.05 MV, and value 2 means respondents showing probable or definite left ventricle hypertrophy by Estes criteria. To conclude, more female respondents are showing probable or definite left ventricular hypertrophy by Estes criteria than male respondents. Next is to compute respondents' knowledge about the fasting blood sugar level over 120 mg per deciliter is normal based on the respondent's age. So based on the bar graph, it shows that the mean of respondents within the age of 21 to 40 years old is 0, and means they totally say that fasting blood sugar level that over 120 mg per deciliter is not normal, while the highest mean is 0.5, which is the respondents at the age of 71 to 80. So older people had less knowledge about the normal fasting blood sugar level than the younger respondents. Next, to analyze the ST depression induced by exercise relative to rest according to the respondent's resting electrocardiographic ECG results. You can see the mean of abnormal resting ECG result is 1.308, meanwhile the mean of normal resting ECG result is 1.006. It is quite a different there, which is 0.3. This shows that respondent with abnormal resting ECG result is likely to having ST depression induced by exercise relative to stress if compared to respondents with normal resting ECG results. We can conclude that if someone have normal resting ECG results may have not get ST depression induced by exercise relative to rest.
In 3.211, we're going to measure exercise-induced angina. Angina is a type of chest pain that resulted from reduced blood flow to the heart. Based on the figure, we can see that male respondent recorded the highest data with a no response on exercise-induced angina at 75 count, whereas for female respondent was 27. Similarly, male respondent also recorded the highest with a yes response on exercise-induced angina with 33 and female with 15. This showed that the majority of the respondent agreed they do not have angina during exercise. Exercise not only can reduce the risk of angina getting worse, but angina can even be cured with exercising. Next, we're going to analyze thalassemia disorder. There were a total of 80 respondents who have a normal blood flow. Out of the 80 patients, 57 of them are male and 23 are female. Even though they have a normal blood flow, it does not mean they do not have a heart disease. In table below, we can prove that out of 80 patients, 12 of them were diagnosed with heart disease. Next, there were a total of 7 patients with fixed defects. Fixed defects happen when there were no signs of blood flow in some part of the heart. Female respondent recorded the highest in fixed defects with 4 and male with 3. Last but not least, a total of 63 patients with reversible defect. Reversible defect is when there is a sign of blood flow that is observed, but it is not normal. Male respondent recorded the highest with 48 and female with 15. In table below, we can also see that patients with reversible defect have the highest number of patients who were diagnosed with heart disease with 52 patients. Lastly, we're going to analyze the diagnosis of heart disease. The patient is injected with radioactive dye into the bloodstream to see visually the blood flowing through the vessel. In the figure, we can see that there were a total of 67 patients who were diagnosed with heart disease and 83 patients who were not diagnosed with heart disease. 50 out of 108 male patients were diagnosed with heart disease as the highest, while 58 other male patients were not diagnosed with heart disease. Whereas for female patients, 17 out of 42 were diagnosed with heart disease and 25 others were not diagnosed with heart disease. From the analysis made based on the respondents' profile analysis, we can conclude that the highest number of patients were male with 108, while female patients recorded with 42, totaling to 150 patients. Even though female patients were recorded lower than male patients, they however recorded the highest in maximum heart rate achieved and resting electrocardiographic. Next, for the analysis related to serum cholesterol, we can conclude that the older the patient, the higher the serum cholesterol that contained in their body. In the fasting blood sugar analysis, we also managed to conclude that the higher the patient age, the lower the knowledge about normal fasting blood sugar level than the younger patients are. In conclusion, heart disease is one of the major concerns for our society today. There are many steps and precautions that can be taken to reduce the chances of getting a heart disease. As we know, a healthy outside starts from the inside.